Today, we're diving deep into a topic that affects many people around the world: candidiasis. This condition, often referred to simply as a yeast infection, is caused primarily by a fungus called Candida. While there are numerous species of Candida, the most common culprit of infections in humans is Candida albicans. Candidiasis can manifest in various forms, depending on where in the body it occurs. The most frequently recognized forms include oral thrush, vaginal yeast infections, and invasive candidiasis, which can impact the bloodstream and internal organs. Let's start by discussing the causes of candidiasis. The Candida fungus is normally present in our bodies, living in places like the gut, skin, and even the mouth. When the balance of microorganisms is disrupted, Candida can flourish and lead to infections. Factors contributing to this overgrowth include a weakened immune system, antibiotic use, diabetes, pregnancy, and high hormone levels. Lifestyle factors, such as poor diet and excessive sugar intake, can also disturb the microbial balance, especially since Candida thrives on sugar. Now, let's explore the symptoms associated with candidiasis. In the case of oral thrush, you may notice white patches on your tongue and inside your mouth, along with soreness or difficulty swallowing. A vaginal yeast infection can result in itching, burning, and unusual discharge, often described as thick and white, resembling cottage cheese. Invasive candidiasis is more severe, presenting symptoms like fever, chills, and a range of issues depending on the affected organs. Diagnosis typically begins with a healthcare provider taking a detailed history and performing a physical examination. For oral thrush, a visual inspection is often enough for diagnosis. Vaginal candidiasis can sometimes be diagnosed through the evaluation of symptoms, but a laboratory test, such as a vaginal swab, can confirm the presence of Candida. In cases of invasive candidiasis, blood tests and other diagnostic tools like imaging studies may be required to assess the nature and extent of the infection. Treating candidiasis depends on the type and severity of the infection. For mild cases like oral thrush or localized vaginal yeast infections, antifungal treatments can be effective. These may come in the form of creams, tablets, or lozenges. In more severe cases, especially with invasive candidiasis, systemic antifungal medications may be necessary and are typically administered intravenously. It's also important to address any underlying conditions contributing to the infection, such as controlling blood sugar levels in diabetic patients. Preventing candidiasis often involves maintaining a balanced diet, managing blood sugar levels for those with diabetes, and practicing good hygiene. For those prone to vaginal yeast infections, wearing breathable cotton underwear and avoiding overly tight clothing can be beneficial. Additionally, caregivers should take special care when treating patients who are critically ill or immunocompromised, as these individuals are at higher risk for invasive infections. While candidiasis can be uncomfortable and disruptive, it is usually treatable when appropriate steps are taken. If you suspect you may have candidiasis, it's crucial to consult with a healthcare provider for accurate diagnosis and treatment options. Always remember that awareness and education about the condition can empower you to make informed decisions about your health. In conclusion, candidiasis is a common condition that can range from mild to severe. Understanding its causes, symptoms, and how to prevent it are vital for anyone concerned about their health. By maintaining a healthy lifestyle and being alert to changes in your body, you can reduce your risk of developing candidiasis. If you found this information helpful, please consider subscribing to our channel for more educational content on health and wellness. Thank you for watching, and take care of yourselves.